Yeah, good morning, Andrew. Thank you for taking the time out of your day to kind of be here to tell us about your career as an orthotist and a prosthetist. Um, to start us off, can you just tell us a little bit about your job and what a typical day looks like in your role?
Yeah, so one of my favorite things about my job is we have a very good work-life balance. I usually get in about like 8 o'clock and I'm done by 5 o'clock. My day consists of popping back and forth between Sparrow Hospital, where I'm seeing patients who have fractures in their back, fitting them for custom braces, and then seeing people back at the hospital as well, or sorry, back at the office as well as an inpatient setting. Usually our prosthetics are going on inside the office where we're doing a lot more orthotics at the hospital.
Sure. Talk to me a little bit about the career path to get into this job and what it looks like. I mean, what kind of experience and training is needed to do what you do?
Yeah, so I have a bachelor's degree from Michigan State, and that's in kinesiology. And so when I was getting that, I was really thinking I was going to be a physical therapist. I really liked working with people. I spent some time shadowing and kind of saw that wasn't for me.
Sure.
My degree made me do a residency type thing at the end of the bachelor's degree. And through that, I got involved in being a prosthetic technician. So I worked as a prosthetic technician where I was making legs for 3 years. And then I decided to go back to school to get my master's degree to be an orthotist prosthetist. So I did that at Eastern Michigan, which is the only place in the state of Michigan that you can do that.
Really?
Yeah. So, and then you go through a residency program following a master's degree as well. So I'm actually in my second year of residency right now.
That's great. Yeah, that's surprising to me that Eastern's the only university in the state that has that degree program. Do you see a lot of demand for your occupation, or is it kind of like a growing field? Or talk to me a little bit about that.
Yeah. Yeah, it's definitely, I would say, a growing field. Things like diabetes, vascular disease, they're not going anywhere. And those are the things that create demand for what we're doing.
Sure.
I think lately we've been seeing some of a decline, maybe because just the change in the auto no-fault insurance. It's kind of messed with some of the coverage that we can do for people. That's been a bit of a challenge for us. But besides that, yeah, as far as technicians, prosthetists, orthotists, there's always openings when you look. There's just not enough of them coming through.
Sure. You touched on the work-life balance a little bit earlier. Tell us some other kind of favorite things about this role, and then maybe conversely, tell us a few things that you don't quite prefer, things that you like the least.
Yeah, like I already kind of said, as far as the work-life balance, I really think that's important. And that's one of the things that was important to me when I was choosing what I wanted to do. Not spending, 10, 12 hours a day, 5 days a week doing this job. I'm leaving most of the work at work, not thinking about it a ton when I'm at home. I think that's really important to me. The things I really like about it is the encounters with people. It's really very rewarding to work with somebody who has lost their mobility and able to help them get it back, help them get back to living more of a normal life. Maybe not doing everything they were doing before, but we'd like to, about 90% of what you were doing before, we can usually get you doing. So, yeah, and then things I don't like, I think it goes through the same thing. I mean, people can be a challenge to work with also. Some, like I said, some cases are very rewarding and they're very pleasant to work with. They don't, the expectations maybe aren't as high. When you deal with people who have very high expectations, and sometimes people are just a little rude. Those are the harder things to deal with, but that's going to happen in any field where you're dealing with people. So
yeah, absolutely. The work-life balance is a really interesting point to me. I think, in the healthcare field, especially, there's that expectations that, yeah, you're working 12-hour shifts and you're working at all times of the day and night. So it's nice to hear that, there's options for people who are kind of looking for that more traditional first shift schedule.
Definitely. Yeah. And there is on call as well, but it's less frequent.
What personal qualities or abilities would you say are important to being successful in a position like this?
I think the first thing is just communication skills. A lot of my job, whether I'm helping somebody or just pointing them in the right direction of something that could help them, is just being able to communicate with them well, and use, I mean, empathy is very important in this field because you have a lot of people who are experiencing things that I've never experienced. I don't really know anybody who's ever experienced it. And so to be able to put myself in their shoes and kind of, not just look at it like I'm just seeing another patient. It's helping this person get back to doing what they want to do. I think that's very important. And then also hand skills are very important in my field. I spend a lot of time in the lab modifying plaster, making things, kind of like a little workshop in the back of our lab. So that's it really splits the two sides of things where you communicating with people a lot, but I'm still spending a lot of time on my own, actually fabricating things. And then the last thing I would say is computer skills. I think any field you go into, computer skills are going to be important, just basic like charting and things like that. But we also use scanning and CAD to modify our models sometimes. It depends on your preference, but all those things can be very important skills to have. And, it's not like you need them going in, but you're definitely going to develop them if you're working in this field.
Yeah, I think you touched on this a little bit when we spoke about the career paths earlier. But as far as opportunities for growth or career advancement once you get into a role like this, are there there's still kind of levels to move up, or are we kind of at the top of the career pathway once we get into this role?
Yeah, so I kind of touched on it originally. I think as you go through the path, I mean, we have a lot of different positions available at Mary Free Bed that are directly working with patients and some not. We have patient representatives in the front who are doing everything from talking on the phone, checking insurance, doing a lot of the stuff that I couldn't do my job without them doing. And then we go to the lab and you have people who are spending all day fabricating things. It's like working in a factory sort of, except you're custom making things for patients, which is really cool. And so in those areas, you obviously have room to grow into management areas and things like that. Once you get to being an orthotist prosthetist, there's a little less. I mean, from where I am now, you could be a team lead, you could be a site manager, you could be a regional manager. But that's all pretty down the road from where I'm at. And definitely more experience that gets you into a position like that rather than more education.
Yeah, absolutely. And I think that's good perspective. The healthcare industry, I think, is definitely kind of a team sport. It takes a lot of people doing a lot of their jobs well to really make the whole process function pretty seamlessly.
Definitely.
Yeah. Think back to high school for me. How does the role you're in now compare to what you were thinking about doing back then? Were you always kind of thinking that healthcare was the path for you, or did that come later on in life?
No, to be completely honest with you, when I graduated high school, I was planning on going to a community college to get a 2-year degree to be a network IT specialist. And I got a little ways into that program and realized I couldn't talk to computers as much as I wanted to.
Sure.
So I kind of pivoted to more of a physical therapy type role. And it was, it was like one of those things where I never planned on getting a master's degree, but it just was the thing, the bachelor's degree was the first thing in my way of what I wanted to do. And then to get to the next position that I wanted to get to, it was a master's degree. And coming out of high school, you think of that sort of thing, like it's all this school, it's horrible. But once you get into a master's program, it's very directed. And you're spending a lot of your time doing things that you actually want to do, learning about things that you actually want to learn. So yeah. I would encourage people not to write that off right away.
Sure. Why physical therapy from IT? What kind of made you pick physical therapy out of everything when you were getting out of that IT space?
Yeah, I was always into sports in high school. I played a lot of sports, and with that, had some injuries. So I had spent some time in physical therapy clinics, and I really liked the one-on-one clinical setting. As I spent more time with therapists, I realized they maybe weren't spending as much. Okay, we're good. As I spent more time with therapists, I realized they weren't maybe spending as much time with patients as I had hoped to. They were spending a lot more time designing a program and having someone else go through it with them.
Yeah.
So then I kind of fell into this and found my way into a more clinical setting on this side of things where, you're helping people. I spend a lot of time still dealing with physical therapists. I go to their offices, watch patients walk. We work together to make a decision on what's best for the patient. I really didn't, go that far from physical therapy, but
Sure.
I like the working with hands portion of this more. And, I have that technology background. So working with some of the higher end microprocessor devices and things like that are kind of right up my alley as well.
Yeah, that's great. Yeah. When you first got into this role, talk to me about some surprises you had. What aspects of the role were different than you expected them to be going in?
Yeah. I would say the biggest thing, and it's one of the biggest things people ask me too, is like, you work with a lot of military people, or you work with a lot of high-end athletes, because we see those on the commercials, and that's in actuality a very small portion of what we're doing here. I think I have maybe one or two patients that could do things that are at that high level. Usually I'm dealing with people that are, have vascular disease, they were born with an amputation, or diabetes. It's a frequent cause of amputation as well. So maybe a surprise to me was, I wasn't doing as much of that high-end physical therapy type aspect, more of, helping people get back on their feet to take their first steps rather than, running.
Sure. What advice might you give to an individual who is considering a career in this field?
I would definitely say to spend some time shadowing in the field. And I know kind of through COVID, it is more difficult to do right now than maybe it was when I was going through it. But I promise, if you give people calls, if you, send them an email, reach out to them, there's people that'll let you in their office, and they'll let you have some experiences, whether it's even in the back, seeing what it's like to fabricate things, which is where I started, or, getting directly into a patient room. It's a different field than a lot of things. And I think it is important, especially if you're going to put in all the time to go to school, to make sure you know what you're getting yourself into, know what you're going to be doing. And I would advise that for anything. Shadow as much as you can, because the more you do that, the more you'll see. Every career has its purpose, but finding the one that you can live with, finding that work-life balance that you like, and making sure, seeing how happy the people are that work in the field is pretty important to me.
Yeah, absolutely. I think it can't be underestimated how important that kind of hands-on first degree experience is to really try to understand whether or not a field is it's a good fit for you.
Yeah.
Any final closing thoughts you'd like to share with the students before we wrap up today?
As far as for the field of orthotics and prosthetics, I think I'd go back to getting your feet wet. If you have any interest in it, get into shadowing, get into a lab, maybe even apply for a position that's not something you think you could do long term, but you're getting your foot in the door, getting yourself an availability to get more experience. And then other than that, I think I'd go back to the education thing just as a broader topic. Maybe you're not interested in healthcare, you're not interested in orthotics and prosthetics. I wouldn't, today you're in high school and you want to be done with school. But eventually, that school is going to get you to a place where you want to be. And I definitely wouldn't write off a higher degree, even if it's, getting into a 2-year degree and getting some experience and finding something that you like to do.
Perfect. That's great perspective. Andrew, thanks so much for taking the time out of your day to kind of share your story with us. And this has been some great information about this occupation and this field. So we're going to hear from a couple other career guides, and then we will have a chance for some students to ask questions and kind of do a Q&A session near the end here. Good morning, Erica. I want to start by saying thank you for taking some time out of your day to help talk to us about the career of a medical assistant. To start us off, can you just tell us a little bit about the job and what a typical day might be like in the role of a medical assistant?
Of course. So it depends on which office a medical assistant is homed in. There are different specialties that medical assistants are able to work within. For the bulk of medical assisting, we are housed in primary care. So that would be like going to a primary care doctor or your doctor for your annual visit or sick visit. And within those visits, you would do anything that the provider would order. So the provider being the doctor or the nurse practitioner or the physician assistant that might be seeing that patient for the day. It's a wide scope that the medical assistant can do as far as orders from the provider. Of course, there is a cutoff before we need a higher licensed professional.
Sure.
But as far as a medical assistant goes, we can give injections, we can give medications, we can place orders and have the provider sign them. We use our electronic medical record, Epic, to outline those orders to us. And as long as we have that written or sometimes even verbal order from the provider, we can move forward with treating the patient in whatever manner the provider asks.
Sure. So, as far as, like hours, how do they typically like your kind of standard 8 to 5, or do they work in like a 12-hour shift? Talk to me a little bit about that.
Again, that depends on the office that you're
Sure.
homed with. There are a lot of options when it comes to scheduling. Me personally, I have worked within urgent care as a medical assistant. So within urgent care, we do have 12-hour shifts between 8 a.m. and 8 p.m. And that's specifically talking about our Spectrum Health urgent care.
Sure.
Urgent care hours will vary. Primary care office hours will vary. If you're in a primary care office, you are looking at that. Usually it's actually like 7 to 5 kind of hours, Monday through Friday. Urgent care hours are usually, at least Spectrum Health, are 8 a.m. to 8 p.m. every day. So that includes weekends. Primary care doesn't typically offer weekend hours, but depending on the office, there may be that opportunity to service the patients on the weekends.
Sure. What does the career path to get into a job as a medical assistant look like? What kind of experience or training is needed for the role?
So I know that there are many different programs, especially in West Michigan. There are a lot of different paths that you can take. So me personally, I went through Grand Rapids Community College, GRCC. It was a 9-month program with a month externship. So at the end of that program, I was able to work and kind of see the role myself without being considered a medical assistant, and before I got my registration and my licensure. And then once I did, I was able to either look for other roles or be homed in that location, which was urgent care for me. So I stayed there. There are other options when it comes to schooling. There are associate's degrees for medical assistants. So universities that offer that, I know Davenport University does offer an associate's level degree as a medical assistant, and then that can transfer into like a registered nurse or RN degree as well.
Sure. Great. Tell me a few of your favorite things about the role, and then conversely, maybe mention 1 or 2 items that you don't quite prefer. That might be your least favorite about the role.
Coincidentally enough, I think my answer to both of those questions are probably just the direct patient care, because depending on the situation, I either thoroughly enjoy working with the patients, they're pleasant, they're very appreciative of my help, whether it's giving them medication that makes them feel better or just kind of reassuring them that their health plan and their guide is smooth. However, on the flip side of that, sometimes there are patients that may not have received the care that they thought they were going to get upon arrival. So it's really it's the good and the bad when it comes to patient care, and it's, you never know, at least when I worked in urgent care, you never know what's going to come through the door specifically. We don't have scheduled appointments where we know that that patient is coming in for this reason. It's kind of whatever shows up, and hopefully they're happy and hopefully they enjoy their care.
What personal qualities or abilities would you say are important to being successful as a medical assistant?
Yeah, the first thing that comes to mind, I would say, would be compassion and that drive to care for patients. We always want to enter a conversation with the patient, letting them know that we care about their trajectory and their health plan. Just letting them know that we're here to service them as medical assistants and whatever we're able to do within our scope to help them.
You know, the healthcare industry is pretty heavily represented on TV and in movies and in media. What would you say are some of the myths about the profession, the industry? What isn't like what you might see on TV?
You know, it depends on the era. I know COVID has driven a lot of media, especially towards nurses and healthcare professionals as a whole. We get the impression that we are burnt out, overworked, underpaid. And while that may be true for some specific professionals, I know that I myself have not been impacted by that. I've actually excelled in my career over the past couple years. So I think that it ultimately depends on where you are and where you want to go, because it's up to you to make that happen.
Sure, that's great to hear. What kind of opportunities for growth and advancement exist for individuals as a medical assistant? What's kind of the path upward, so to speak, if you're interested in continuing to advance your career?
Absolutely. So I'll kind of start with where I began. I actually started with Spectrum Health, just hit my 6-year anniversary this week. I started as kind of a lower entry level administrative role, a lot of office work, not any patient care. So seeing the medical assistants that I worked with provide that patient care is what drove me to then go to school to become a medical assistant myself. So then what happened is I had that administrative experience along with my clinical experience, which allowed me to elevate into a practice supervisor role. So now not only was I provided with that clinical experience, but now I was able to lead and educate more medical assistants along the way.
Yeah, that's great. Thinking back to high school for me for a moment, how does this role compare to what you wanted to do as a career back then? Were you always kind of thinking the healthcare industry, or did something point you along that path later on?
I really did always plan on being within healthcare as long as I could remember. I know initially I wanted to be a teacher for a short period of time, but then going into healthcare kind of is what drove me into applying to Spectrum Health 6 years ago now. And I didn't at the time know what I wanted to do. I just knew that I wanted it to be within healthcare. So what I ultimately did is I went on Spectrum Health's website. I applied for every role that I qualified for at the time. Strong strategy, because that's what led me here today. But ultimately, it's just trying to put your foot in the door in an area that you'd like to be in. I didn't expect or plan on being within urgent care, but I was very grateful that that's where I landed.
And so when you first kind of got into the medical assistant field, what were some surprises you had? What aspects of the role were different than you expected them to be?
I was surprised by how much we actually could do. There is kind of that myth or things that you hear from others that medical assistants are limited on their roles and responsibilities. Like you can just take vitals. You hear people think that medical assistants can just document or just take vitals, but truly we can administer medications, we can administer immunizations. It's very, you would kind of relate it almost to an LPN type role, licensed practical nurse. So that would be kind of the next role above a medical assistant, where truly there are many differences, but the main difference is an LPN can start IVs. So medical assistants can't do that, but just that next role up, that's how much more that would provide. And then above that LPN is where you would get the RN and up from there.
Sure. What advice would you give to an individual who is considering a career as a medical assistant, or really just a career in healthcare in general?
I would say, as far as a medical assistant would go, is explore the specialties. There are so many areas that a medical assistant can work in. You can even work in an administrative role as a medical assistant. We go through administrative roles and responsibilities while in school, so we get very familiar with those. But just look to see what's out there. You would be surprised by the type of offices that employ medical assistants. You can work in an esthetician's office. You can work in neurology. You can work in pediatrics or primary care or any of those things. But it's good to like explore options and see what drives your interest the most.
Sure. Do you find medical assistants in the hospital setting at all, or is it traditionally more of kind of an outpatient, outer office focused role?
It tends to be more outpatient, meaning not in the hospital. However, you can find medical assistants in certain roles. Usually it's like outpatient offices within the hospital, if that makes sense.
Sure.
So normally, like inpatient hospital setting, you would see like those nurse techs or RNs or LPNs. Medical assistants tend to primarily be in those outpatient facing roles.
Great. Any final closing thoughts or comments you'd like to share before we wrap up, Erica?
No, I really implore students to explore those options. I think once you have an idea of a field that you'd like to go in, look at what kind of roles and responsibilities are included within each career path. Look at the path, look at the trajectory, look at where you would see medical assistants 5 years from now, 10 years from now, and just explore those career options and decide what path is best for you.
Sure. Thank you so much again for taking the time to share a little bit about your story and some great information for the students about the medical assistant profession. Good morning, Sarah. I want to start by thanking you for taking some time out of your day to tell us a little bit about your career and about the profession of registered nursing. Can you start by just telling us a little bit about the registered nurse role, what a typical day might be like, and some of the aspects of the job?
Yeah, absolutely. And good morning, everyone. I'm super excited to be here to talk to you all about a career in nursing, and happy to answer any questions that you have at the end as well. So if it's okay, Trevor, I'd like to share my screen. I have a few slides and a short video to go through.
Yeah, absolutely.
Great. Awesome. All right. Can you see my slides?
Yes, you are good to go.
Great. All right. So as I said, we're talking about nursing here and specifically registered nurses. I'm going to just start out with a little video here.
During the Crimean War, more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and immobilize patients. Until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread. So patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand: garbage bags and duct tape, to protect herself so she could care for others. and cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her.
That's great, Sarah. Thank you.
Yeah, of course. So can you see my slides again now?
I am still on your YouTube link.
Oh, how about now? Still YouTube?
Still YouTube. On the Zoom locked screen now.
Let's see here. Still Zoom?
Yep.
Okay. Let's. How about now?
There, back to the slides now.
All right, perfect. Sorry about that.
No problem.
All right. So just a little bit about me. My name is Sarah Vanderplug. I've been a nurse since 2010. I work for Spectrum Health. Have worked here for my entire career. I really love it here. I've been through a number of different roles since I started my career here in 2010. So at first I was a bedside nurse, and I would say that's where most people start their career as a nurse after graduating. The majority of people end up finding a position, you know, in a hospital, on a unit, whether it's in a med-surg unit or a critical care unit,
Sure.
An emergency department. I would say the majority of folks start their career that way, but then there's lots of different branches and ways you can take your career from there. Some people do stay in a bedside nurse for their entire career, and that's really awesome too. From my bedside nurse role, I became a supervisor on one of the units, then transitioned to a different unit as a nurse manager, worked in one of our OB units for a while as the nurse manager, and now my position is the nursing staffing program manager, which is kind of an interesting title. I manage a lot of our different staffing programs. So I'm part of our kind of nursing operations administrative department. I have our central staffing office. I manage all of our new graduate nurses that come into our system. And our float pool nurses that float all throughout our Spectrum Health system, which, as you may or may not know, we are kind of all over West Michigan. So we have a small group of nurses that float all throughout those regional hospitals to meet the needs of each area. So that's a little bit about me. The picture is not me, obviously, but all of the other information is about me. Just a bit about my career path and kind of how I got here. When I was in high school and even early in my college career, I looked a bit like the girl in the picture there. I was kind of a little bit clueless as to what I wanted to do for my career. I liked writing, so I thought maybe journalism. I kind of liked a little bit about science, so maybe science or biology. I was kind of good at math, so I thought, oh, maybe I'll do something with math or accounting. Nursing really didn't come into play until I was early in my college career. And I had a roommate that was in nursing school, and I just really thought like the things that she was studying and learning were interesting, and decided to go that path. And I haven't regretted it a day since. So I think nursing is a really awesome career to go into. I think what the video showed is that nurses have been making a difference in people's lives for a long time. And there's a lot of careers that make a difference in people's lives, but nurses really get to spend time with patients and people that are going through really tough things in their life, and also some of the most happy moments in their life, and get to walk that path with them and just really make a difference. So in nursing school, I had no idea what kind of nursing I wanted to do. So I thought maybe labor and delivery, maybe the emergency room. I liked both of those clinical rotations and thought maybe this is where my career will take me. What actually happened after I graduated was I got a job on one of our cardiac or heart floors and worked there as a bedside nurse. A couple years later, I became a charge nurse, which is kind of like an informal leader role on a unit that kind of manages the patients and the beds on that unit during the day or night. I was a preceptor, so I was training our new nurses. I became a supervisor eventually, and then a nurse manager. So that is a bit about my career path and kind of how I got to where I am today.
Yeah, that's a great start and some great information. So thank you for sharing, and thanks for getting a little personal with it and sharing something about kind of your own story.
Yeah, absolutely. So a bit about nursing just as a career in general and kind of the requirements and what you need to do or know to become a nurse. So An associate's or a bachelor's degree is required to become an RN. Some locations or some hospitals or facilities may require that you have a bachelor's degree. I know specifically at Spectrum, you can come into our system with an associate's degree, but you are required to get your bachelor's degree within a certain number of years. There are a number of programs around West Michigan that have associate's or bachelor's degree nursing programs. And Valley, Ferris, GRCC, all over the place, there's nursing programs. So we have a lot of them around here. A master's degree, definitely not required for nursing, but some people do go on and obtain a master's degree. There are kind of different tracks you can take with that: leadership, informatics, education, and then a doctorate of nursing practice is also a doctorate level degree that you can achieve as a nurse. So lots of opportunities to further your kind of formal education. Certifications sometimes are required for roles and sometimes aren't. At Spectrum Health, any leadership role does require a certification. There are leadership certifications. There are different types of clinical certifications. So, for example, there's an ICU certification or progressive care or an oncology certification. So those are specialty based. Some of the skills, qualities, and traits that aren't necessarily required, but I think are good to have as a nurse. You have to like working with people. That's kind of a deal breaker if you don't like working with people and you want to be a nurse and take care of patients. Teamwork is super important. It can be a tough job, and sometimes unexpected things happen, especially in the hospital when you're dealing with really sick patients. And you have to be able to rely on your team, and your team has to be able to rely on you to help out to make sure that all of the patients are cared for. And then really good communication skills. So you're working with a lot of different members of the interdisciplinary healthcare team, providers, physical therapy, nutrition, care management. The list could go on, and you have to be able to communicate the patient's needs and what's going on with that patient with all of those team members so that they receive the care they need. And then continuing education was just something I mentioned there. With an RN license comes a requirement for 25 continuing education hours every 2 years. So there is a requirement that you kind of continue your education, and usually organizations offer different opportunities to get that continuing education. It's not necessarily that you have to go back into a classroom to obtain that. Sure.
Talk to me a little bit. Think back to kind of just starting out in your nursing career. What kind of things surprised you? What kind of things were different than you expected going into the role?
Yeah, I mean, when you are in nursing school, you're learning from a textbook, right? So things, when you learn about different disease processes and things like that, each patient doesn't present the same way. They don't present the same way as they do in the textbook. Their labs aren't, exactly off the way that you would expect in a textbook, or they might have other conditions that are contributing to, something not presenting in the same way that you learned. So you really have to learn as you go, get to know your patients really well, understand their history, be willing to ask questions, because even if you know your textbook from front to back, cover to cover, your patients aren't gonna look necessarily like they do in the textbook. It'll be helpful information, but it's not gonna be the same.
Sure, absolutely. And so kind of in a similar vein, but in a little bit of a broader sense, the healthcare industry, it's so heavily represented on, TV and in the media and in movies. So, what are some things that you feel like represented in kind of the media that are kind of like myths? What did they get wrong that's different from the reality of their role?
So I don't watch a ton of healthcare TV, but one thing I do know is that nurses do a lot more in the hospital than they get credit for on TV. Sure. So sometimes in TV shows, you'll see doctors that are, transporting patients to CAT scan or putting in their IVs. And I'm not saying that never happens, but that's typically a lot of what gets done by the nursing staff. And so I would say that nurses do a lot more than they get credit for in the media.
Yeah, absolutely.
Yeah.
Yeah. What are some of your just favorite things about the role? What do you like about nursing, and what maybe things are not super glamorous and maybe not your favorite things to do?
Yeah, well, I'll start with the good. So as a bedside nurse, when I worked with, closely with patients every day, one of my favorite things was to work, 3 days in a row and have the same patient 3 days in a row and get to know them and their loved one and what was important to them and watch them get better or meet their health goals, whatever that may be. Because one thing I haven't mentioned yet is not everyone's goal is to get better. Sometimes people's goal is to, peacefully pass away comfortably. And, they know they're not going to get better. And their goal is just to have some quality of life with whatever time they have left. So really getting to know your patients and what's important to them and helping them to meet those goals is really, really a rewarding part of the job.
Absolutely.
My job right now, I would say my favorite part is getting to work with all of the new graduate nurses and see them kind of blossom and figure out what path is right for them. And I just really enjoy that part as well.
Yeah, that's great. We've talked about a lot about nurses in kind of a hospital setting.
Yeah.
Talk a little bit about, maybe some roles that are available and kind of more the outpatient setting and less the kind of main hospital space.
And this is like not exactly my expertise, but I have a little bit of knowledge around this. So certainly, nursing has a role in, doctor's offices and things like that, home care. So going into patients' homes that, aren't sick enough to be in the hospital, but do need some either IV medications or different treatments that they can get at home that don't necessarily require, being in the hospital, but need the care of a nurse. There is hospice nursing, which is really caring for patients and their loved ones through the dying process. A lot of times that occurs at home or in a hospice facility, not necessarily in the hospital. Those are very special nurses, and they really, really make a strong impact on those patients and families through a really difficult time.
Absolutely. What kind of general advice do you have for those considering a career in the nursing profession?
Yeah, for sure. So I think one of the biggest things is work on your active listening and your understanding of what people are trying to tell you when they're talking to you, and understanding what's important to folks, because it's not necessarily what's the same thing as what's important to you.
Sure.
Another thing I think is, practical wise, is try to get a job in a healthcare facility, even if it's just, even if it's, bringing food to patients, or as a nursing technician, supporting the nursing staff on the unit before you have your nursing license. That experience is really invaluable and will help you in your career as a nurse, and will help you get going more quickly and more efficiently, and help you feel comfortable in caring for those patients.
Absolutely. Any kind of final closing thoughts or anything you'd like to share before we wrap up here, Sarah?
No, one thing I briefly mentioned it, and it's on this slide here that's up on the screen, just that there's endless opportunity in nursing. So like I said, a lot of new nurses go into bedside nursing and work in the hospital and caring for patients, but I put a list here, and it's definitely not all inclusive, but there are many, many different roles that
I think we're still on the about. I'm on the about me slide.
Oh, I'm so sorry.
That's for the right slide here. There we are. Okay.
Oh my goodness. Sorry about that. I missed a couple of slides in there, but I talked through them, so I think we're good.
Okay. Yeah. Perfect.
Sorry about that. So the list here at the bottom, where it just lists different careers paths that you can take, I would say, as a nurse. I don't have the number, but there are like 100 and something job codes at Spectrum Health that require a nursing license. So you don't necessarily have to, be at the bedside caring for patients. If that's not something that's for you, you can branch off in many different paths and, still use your nursing license in a different way. So.
Absolutely. Well, Sarah, thanks so much again for taking your time out of your day to come kind of share a little bit about your story and a little bit about the nursing profession. I think that was some great information for the students, and we'll have some time for a little bit of Q&A. So hopefully they'll have some good questions to ask as well.
Great. Thank you so much.